Good morning, everyone, and thank you so much for being with us. I want to start by thanking the dedicated leaders who have joined us today. Chairwoman Barger, Supervisor Solis, Supervisor Hahn. Their efforts, along with the efforts of the entire board, have been ensuring all along that the county is responding appropriately to the expanding outbreaks that are caused by novel coronavirus. They've been elevating issues from the very beginning related to the inappropriate rise in stigma and discrimination, and modeling the need for us to support our Asian friends, neighbors, and businesses. I'm also grateful to have Mayor Garcetti with us today. He's been setting a path that we can take so that we're informed, prepared, and thoughtful in our responses to the challenges presented by a new virus. We're also joined and really honored to have with us Dr. Go, who's the director of the City of Pasadena Health Department, and Dr. Davis, who's the health officer for the City of Long Beach. And you will hear from them about their efforts as well, so that you understand we're coordinated across all of the health departments in this wonderful county. We have an amazing county team, our CEO, Sachi Hamai, our COO, Feja Davenport, my partners in the health, the new Alliance for Health Integration, Dr. Christina Galley at the Department of Health Services, and Dr. Sharon at the Department of Mental Health, and also Kevin McGowan, who is the director of our Office of Emergency Management. I want to acknowledge that this is a team that has been working diligently under the leadership of our amazing board to be well prepared, and that today's actions really just allow us to enhance work that has been ongoing. I also want to acknowledge and thank all of the media, both for your accurate reporting and your thoughtful responses to inquiries. We really appreciate your ability to get information out to the general public. As Chairwoman Barger stated, in response to the increasing number of cases in the United States, our new 6 cases here in LA County, the increasing likelihood of community transmission occurring both across the United States and at some point here in our county, and the need for us to work cooperatively and proactively to slow the spread of COVID-19, the disease caused by the novel coronavirus. The LA County Department of Public Health, through the authority of our health officer, Dr. Davis, is also declaring a local health emergency today. These actions support our preparedness efforts, including effectively mobilizing needed resources and partnerships, enhancing continuity of operations, planning, and seeking and utilizing mutual aid, all in an effort to slow the spread of COVID-19 and to address any challenges that may arise with increased cases and community transmission. Emergency declarations enhance our ability as well to seek future reimbursement from both the state and federal governments should funding become available. I want to emphasize, as both of our supervisors had, that we can't do this work by ourselves, and we continue to mobilize with partners across the healthcare, business, faith-based, education, government, and community sectors to build out our plans to limit spread and protect those most vulnerable to serious illness. We need to ensure that the actions we're taking to date are amplified, as well as that we continue to make great progress educating our public and bringing people together to promote effective strategies that limit disease transmission, while also acknowledging that we need to be prepared for more cases. In the days and weeks ahead, the Department of Public Health will enhance our current activities in the following areas. We are increasing our capacity for testing at our local public health lab. Public health is among 10 California health labs that have received CDC test kits, and we have additional kits on the way. We are currently testing, and have been since last Wednesday, locally for COVID-19. We will ensure that people who test positive for the novel coronavirus and their close contacts are quickly identified and closely monitored and supported while they're in isolation and/or quarantined. We will start tomorrow with daily radio briefings on 3 different stations by the public health director, and I'll be joined by our health officer. We are posting new guidelines as we speak for child care facilities, schools, colleges and universities, employers, hotels, public safety responders, shelters, congregate living facilities, and parents on how they can prepare for and slow the spread of COVID-19. We continue to hold weekly telebriefings with elected officials, city managers, and leaders at businesses, organizations, schools, faith-based communities, and healthcare facilities. We are in contact with over 3,500 leaders and administrators across the county on a weekly basis. We are holding an educational webinar for all of our skilled nursing facilities at the end of this week so that they too can make sure they're adequately prepared for the possibility of cases within their facilities. We are sending out technical assistant teams starting today for site visits over the next week to every single interim housing facility to assist in the implementation of environmental practices and modifications that can reduce transmission of respiratory illness in our congregate living facilities. We're communicating and preparing with our first responders, healthcare facility partners, and healthcare providers to make sure that we have continued readiness for this dynamic situation. Paying a lot of attention to making sure we have adequate personal protection equipment for our wonderful and dedicated and skilled healthcare workers. Protecting our workforce, our healthcare workforce, is a high priority. We are updating our pandemic response plan for COVID-19 in accordance with CDC guidance and local conditions. And working with the Office of Emergency Management, we are opening our EOC today to coordinate across the city departments. I want to give a brief update. As you know, there are increasing cases of COVID-19 across the United States. Today we're announcing 6 new cases. We've confirmed these cases as of last night with positive lab results from our local lab, and we have completed investigations. All of our cases, all of our 6 new cases, are linked to an assumed known exposure. There's either a travel history to an area with an outbreak, there's exposure to known travelers coming from areas where there's an outbreak, or the person is a close contact with a confirmed case. I want to repeat, we have information that allows us to announce that we know of an assumed known exposure source for all 6 of our new cases that we're announcing today. This means that as of today, we still don't have known cases of community transmission. Like other large jurisdictions, we anticipate more local cases. This is because there are increases in outbreaks all across the world, and the fact is that people who are in close contact with folks who are infected with novel coronavirus can themselves become infected. We know that we have effective public health interventions that slow the spread of infectious diseases, especially when we're all working together. So what can we all do? I want to start with what's most important. Stay home if you're sick. Sick people make other people sick. That's the main route of transmission, a sick person coming into contact with somebody who's well. So if you're sick with anything, including mild illness, we need people to stay home. We need people to wash their hands with soap and water for at least 20 seconds frequently. We need people to cover their coughs or their sneezes with tissues and then throw those tissues into the trash and wash your hands. We know it's allergy season here in LA County, but we still need people to adhere to common sense public health practices. And there's still time for people to get immunized against the flu, and we encourage this. As many cases as we have of influenza, reducing that number reduces the burden and the stress on our healthcare system, which will see more need to respond to the increasing number of cases of COVID-19. We also ask that the public plan for the possibility of more extensive social distancing requirements. These measures would include having an ample supply of essentials at home, no different than the preparedness activities we ask people to do to be ready for natural disasters, earthquakes, fires, floods, mudslides. We do need folks to plan for the possibility of business disruptions, school closures, and modifications or cancellations of select public events. We will be working closely with schools and public event venues and businesses before decisions are made to close. But this is the time for people to have a plan of what they would do should their child's school need to close. We ask everyone to start practicing sort of what we call simple social distancing practices. Use verbal salutations in place of handshakes and hugs. Don't share utensils, cups, and linens. And whenever possible, try to keep 6 feet between you and other people that you don't know at large events. If you're an organization, a business, a human service provider, there are additional strategies that we ask you to adopt. We need you to make sure that your bathrooms are well stocked and can support hand washing. We need folks to take a look at their sick leave policies so that they're flexible, non-punitive, and consistent with public health guidance. Implement plans that allow people to stay home if they're mildly ill without the risk of being academically or financially penalized. Make sure at your business and at your organization's location that you're performing regular cleaning and disinfection for frequently touched surfaces. Ensure that your continuity of operation plans are up to date so that your essential functions can continue should you see large numbers of people that are sick and unable to get to work. And we ask that also leave policies be modified so that we don't require a doctor's note for staff returning to work after being sick wherever possible. This reduces the strain on the healthcare system for people with mild illness needing to come in to get their doctor's note. Everyone should be aware of scammers who are spreading false information, particularly those that are trying to sell medications and treatments with promises of cure and protection. There are no specific medication treatments or vaccinations currently available and approved for treating or vaccinating against COVID-19. As always, we ask you to check with trusted resources for accurate, up-to-date information about novel coronavirus. And use our website, publichealth.lacounty.gov, for information about increasing numbers of cases or information about steps and guidance for efforts you can take to protect yourselves and those that you love. I want to thank the supervisors and the mayor for their leadership and their support for public health efforts. I want to thank all of our partners, especially the cities of Long Beach and Pasadena, for all of their support. And I want to really close by thanking the general public for doing what you can to stay informed and protect yourselves and help us slow the spread of respiratory illnesses in our community. Thank you very much.
And now I'd like to introduce the mayor of the city of Los Angeles, Eric Garcetti.
Thank you so much, Madam Chair, and let me just say how what a joy it is to serve with you and Hilda Solis and Janice Hahn, the Board of Supervisors. In so many places where jurisdictions are divided, we are so united, and thank you for your leadership and close coordination. And thank you, Dr. Ferrer, too, for your exceptional leadership here for all the residents of the County of Los Angeles, as well as your national leadership as part of the ongoing conversation around coronavirus and COVID-19. We've come together across Los Angeles County this morning to offer this information, this guidance, and I hope some reassurance to the residents of Los Angeles about COVID-19. We've all seen the headlines and followed the news. We know the threats that this virus has introduced to communities, not just here in this country, but around the globe. But our main message is that the City of Los Angeles, other cities in the county, and the County of Los Angeles have done everything possible to be ready. But this is everybody's responsibility. We have to be prepared. We have to protect the well-being of our loved ones and our neighbors. But before I say more about the things that we're doing in the city, I think it's very important for us to also recognize that this isn't just something for government to do alone, that it's critically important in our workplaces, critically important in our households, that we each take responsibility for slowing the spread of what we know is now here and will be here. to limit our own exposure, but not to panic, but instead to be prepared.